crime scene to a horror movie. Brand new body camera captures the unsettling aftermath when a high schooler gave birth in an emergency room bathroom, allegedly killing her newborn son.
I've never, ever seen a reaction like that girl.
On January 27th, 19-year-old Alexi Treviso was admitted to an Artesia, New Mexico emergency room after complaining of back pain. Her newborn son was later found stuffed inside a trash can in a bloody bathroom she had just used. The high school senior was charged with first-degree murder and tampering with evidence before her graduation.
We discovered a dead baby in the bathroom.
Oh my gosh. I'm sorry. He came out at me and I didn't know what to do.
Long Crime Network first brought you the chilling body camera video last month when medical professionals confronted Treviso about the baby.
See, I told you about this. I just asked you, baby, to tell me the truth. It was not crying or nothing. What did you do to it?
Now we're hearing from medical staff who uncovered the gruesome scene after she gave birth.
When I went in there, it was a bloody massacre.
Body camera video shows police officers speaking with medical staff who worked the night Treviso was admitted into the ER.
She said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
Hospital surveillance video shows Treviso leave her patient room at 1:38 a.m., waddling toward the bathroom while clutching her back. Treviso remains in the bathroom for 19 minutes as multiple people check on her.
I knocked on the door and I said, "Are you okay?" And she said, "Yes, I'm fine. I'm just having a hard time going to the bathroom," is what she replied. So I was like, okay.
At some point, I went and kind of checked on her, knocked on the door, seen if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flushing it, toilet flush?
Yes. After a while, I started hearing. So I probably checked on her 2 to 3 times. I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again. Did she need anything? Denied anything. And then eventually it got to a point where I said, "You need to come out." And I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that point?
She didn't say anything. She was just looking kind of straight past me and went back to the room.
Surveillance video captures that moment as Treviso leaves the bathroom and heads back to the patient room. It was then that hospital staff got a look at the bloody bathroom for the first time.
And all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
Police speak to multiple people who saw the bathroom, describing fresh blood on the walls, floor, and near the toilet.
The toilet's right here where you're at, and then the sink's right here. It was like up this way, blood splatter. Like,
in your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like if you rip something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just.
So like you say, like rip, like something went like that?
Yeah, like when you rip something, or if you cut something and you go, like you swing your hand and blood just splatters.
Okay, so
that's how it looked.
Oh, so this was fresh to you?
Yes, this blood was fresh. You could even smell it.
We didn't know what this blood was from. We were a little concerned that maybe she had, known that we were going to figure it out and that she might have harmed herself or something in the restroom, so the doc wanted to go check her, but obviously that wasn't the case.
Unclear as to what had happened, other nursing staff care for Treviso, believing she had a miscarriage.
Oh, she came out of the restroom. There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems, essentially, I'm not sure the exact words, because it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which didn't seem totally abnormal. I've seen awful miscarriages before that are very bloody.
Right.
And so...
was she bloody?
Mm-hmm. And then there
her
was
legs. And
yeah, she had blood all down her legs, and then there was like blood in the bathroom everywhere. So
Where exactly was the blood and how much?
it was a good amount. It was like on the floor.
Minutes later, cleaning staff arrived to wash up the bathroom.
I was called and to go clean the patient's bathroom in ER around, maybe 2 o'clock or so, I think it was the time, I'm not too sure. So when I went in there, it was a gory, bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall.
Do you remember which wall?
The one behind the toilet, and then the one on the side right here. You know, there's the one where the toilet sits, the back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere.
After cleaning the entire bathroom twice, the cleaner grabbed the trash bag to toss it away. That's when she discovered the newborn baby.
When I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was there was trash in it, but I knew that it didn't feel like when I picked it up, it was some weight. So I thought it was the trash bags, because we put the trash bags on the bottom.
Mm-hmm.
And so I started getting the trash out, and then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like at the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, like as soon as you picked it up?
No, after I picked up the trash bag that was on top,
Okay,
where
so
they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
You like describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that, and he was like purple, pink skin type color.
The cleaner then calls for a nurse who describes the disturbing moment the infant was discovered.
And then when I picked it up, that's when I noticed it even more, because all I saw was black and purple. But once we picked it up, like the bag suctioned to his face. And that's when I yelled for my charge nurse, which was HT. And I told him, hey, she put her baby in the trash can. So I handed the baby to him. And he took off to the trauma room and opened up the bag. And then that's when we went and got Dr. Vasquez.
Police then hear from the nurse in charge, who says it was clear early on that the newborn was dead.
I go in the bathroom and she goes, something's in the trash can. I'm like, I looked in there, there's a clean liner. I'm like, what are you talking about? She goes, pick it up. I picked it, I could feel the weight. I knew then we had a serious problem. I just grabbed the trash can and went right across the hall into trauma 2. The liner was pulled out, but there was another trash bag in there in the bottom, but it was all it was rolled up. So I had to tear it apart. And then, of course, I saw the baby in there. So I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever. I immediately came out of there after I did that, went into the room where she was performing the vaginal exam, and I immediately told her, you have to come out now. And she came out, and we went into trauma 2, and she reassessed the baby. At that time, between me and Chris and her, we determined, there was no reason for us to begin any life saving. The baby was completely gone.
Another nurse recalls the same moments.
And could you tell if the baby was alive or
They did
passed?
not look alive.
They didn't look
They
alive.
They looked. But also, I think the time that passed since she left the bathroom and it being in the bag, it was just.
How long do you think that was?
Maybe like 10 or 15 minutes. I just have a guess. I don't know. We brought the baby up. We called the doctor, obviously, out of the room from her exam, and we came in, doc assessed the baby, and basically determined it was not viable to completely work the baby and all of that. So.
That nurse tells officers he believes Treviso knew she was pregnant and wanted to hide it from medical staff.
It seemed like we were being just deceived from the beginning, but that's just my take on it. It seemed like she was very manipulative with us, and it was at least what it seemed like to me. She didn't want you to discover you know, that she was pregnant, and she wore really baggy clothing. Yeah, and she wouldn't sit still for you. I'm sure she was very uncomfortable too, but yeah, she wouldn't allow you to do it.
It seemed like she'd been trying to hide this pregnancy from her mother for some time. So if you know you're pregnant, you're not going to continue taking birth control pills. But if you're trying to hide it, you might start taking weight loss medications. That's just kind of what it seemed like in my head.
Other staff described the lengths Treviso allegedly went to keep her pregnancy and birth a secret.
The umbilical cord looked like an animal had tore it apart. Like, you know, have you ever eaten string cheese? And, you know, when you twist it, that's how the bottom of the umbilical cord looked. And I just remember it caught my eye, and I was like, God. I was like, this chick really ripped this thing apart.
After this, medical staff called the police and alert Treviso about their discovery.
I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
And then I went in there to talk to the patient.
No, it's a natural thing to do.
I mean, it's just hard because I'm a mother, I'm a grandmother. And I've dealt with death before, but never like this.
Right.
You know, like, it was horrible.
I'm just going to tell you this. I've never, ever seen a reaction like that girl. I don't even know what to say about it. There was zero emotion. I don't even know what to say. I've never seen anything like it. I've seen women that are only married, or not married, but pregnant for 6 weeks and they lose that baby and they're a mess. You know what I mean? That girl went into that bathroom, made no sounds at all, and the baby came out of her. And I don't even know how she functioned that way to do what she did and with no emotion. I've never seen anything like it.
And it was a pretty good sized baby. Pretty good size.
It looked term to me.
Yeah, me too.
I mean, it was term. I can't tell you that was, but the only thing that upsets me the most is I understand she was scared, and I think her mother had a big dynamic on her, and I understand that. I mean, I think her mother was probably pretty controlling. I don't know that. I'm just speculation. But she gave me no chance to save that baby. I had no chance, and that's not what I do. My job is to save lives, and I had no chance on that baby. She gave me no chance. And we are a facility that you can drop the baby off, no questions asked. You can just leave the baby and go. I don't care, you know, as long as you bring the baby to a safe. We are one of those type of hospitals, so it's hard to fathom what was going on in her mind. I don't know. I've never seen anything like that, and I pray to God I never see it again.
A jury trial date for Treviso has been set for October 2nd. If convicted on the top count of first-degree murder, she could face life in prison. Reporting for Long Crime Network, I'm Sierra Gillespie.